This is J. Stewart Hunter, Assistant to the Surgeon General for Information. In view of the importance and widespread interest in the report on smoking and health, Dr. Terry thought the staff of the Public Health Service in field installations would appreciate hearing a tape recording of the press conference held in Washington on Saturday, January the 11th. Here is Dr. Terry.
All of you, I'm sure, have read about the report of the Committee on Smoking and Health. By now, most of our field installations will have received a copy of the report, and you may already have had a chance to see it. Because of the very great public interest in the report, it occurred to me that you might like to hear the verbatim record of the press conference itself. It was held in the Department of State Auditorium, the same facility used for the President's press conferences, beginning at 11 o'clock in the morning. Prior to that, at 9:30, the 200 reporters who attended the conference had been given copies of the 387-page document. Anyone entering the building was allowed to come in during this study period. None could leave, however, until 11:30, and the deadline for the release of the report was set at noon. These precautions were taken to make sure that all members of the press got an even break on its release. The 3 television networks, the radio chains, worked as a pool, with CBS doing the filming for all of the networks. The filming was done on tape, and the radio reporting was recorded in order to preserve the deadline. The release of this report was, without doubt, our news story of the year. The regular press corps in Washington, science reporters from all over the United States and some from abroad attended the conference, and it was reported in newspapers and by television and radio around the world. As you would expect, the demand for copies has been enormous. I am told that the Superintendent of Documents placed 10,000 copies on sale on the Tuesday following release of the report, and the supply was exhausted before the end of the day. It will probably remain a bestseller for some time to come. We have also made additional wide distribution of the report to the Congress, other interested agencies of the government, such as the Departments of Agriculture and Commerce, the Federal Trade Commission, our own embassies abroad, the embassies of foreign governments here in Washington, state health agencies and voluntary health organizations, and the heads of tobacco companies and advertising agencies, and many others. I have no doubt that the demand will continue, and we will, of course, continue to fill single copy requests for our colleagues in public health inside and outside the service. Such requests are handled by the Public Inquiries Branch of our Office of Information and Publications. This is by way of a little of the background to the following: a recording as it took place of the press conference at which the report on smoking and health was made public. Ladies and gentlemen, in opening this press conference on the report of the Advisory Committee on Smoking and Health, I want to express our great gratitude to the distinguished members of this committee. The
Hunter, Assistant to the Surgeon. In view of widespread interest in health, Doctors of the Public Health Service in field would appreciate hearing a conference held in Washington, January the 11th.
I have read about the report on health. Installations will report, and you may see it. Interest in the report. I'd like to hear the verbatim press conference itself in the Department of State Auditorium used for the President's press, beginning at 11 o'clock. Prior to that, at 9, reporters who attended the conference copies of the 300 document. Holding was allowed to come in. None could leave 11:30, and the report was set at noon. Precautions were taken to make the press got an ease. The 3 television, the radio chains, with CBS doing the filming was, the radio reporting was recorded, the deadline. The release of this report was without news story of the year. In Washington, some United States and some from the conference, and it was by television and radio. The demand for copies has, I'm told that the 10,000 copies on Tuesday following release of the report was exhausted before it will probably remain up to come. Also made additional work to the constant agencies of the government, culture and commerce, our own, the embassies of foreign governments, state health agent organizations, and advertising agencies. And will continue to fill single copy requests in public health service, such as the Public Inquiries Branch, information and publication. This is by way to the following. A report of the press conference at Health was made public. Ladies and gentlemen, in opening this report of the Advisory in Health, our great gratitude to members of this committee. The unstinted devotion their scientific excavation of this report, the most common analysis on the relationship and health. At the time, I was an eminent scientist to undertake, neither they appreciated the immensity on which they would, nor did any of us realize time and effort the evaluation. And to the committee immeasurably. When you note the value which had to be by the committee, it is that such a massive and could have been accomplished in time. Finished its work, Secretary asked me to make its report as soon as possible. Report from the government printing office this morning, distribution to the heads of other agencies who have an illusions. Copies to the governors, to the state health office, voluntary health representatives of industry and others concerned. In the next few weeks, report to the physician just as soon as adequately available. Out of its long innings, the committee has reached the old that cigarette smoking is of sufficient importance to warrant this owed by many converging evidence, as well as cigarette smoking rates in a number of more. The committee states on page, and I quote, continuing and mounting evidence, it is a judgment of the committee smoking contributes substantiality from certain specific and to the overall. Cigar found to have little significance with cigarettes. Noted that the committee's what appropriate be not a part of the response to make such recommendations. I can assure that we will move remedial health measures service should take. Secretary Celebrezzi has support and to make recommendations. The staff of the now receiving the report want their recommendation. Departments and agencies, along with non-federal, also take the report into consideration promptly. For our conferences, full committee of our staff, introduce first to you Assistant Surgeon General who served as Dr. Huntley. Next, I would like to introduce who was Staff Director. Next, I would like to introduce Dr. Medical Coordinator, and then in alphabetical order, members of the committee. Stanhope Bain Jones. Next, Burdett. Professor Dr. John, Dr. Louis F. Firth, Dr. Charles Maurice H. C. M. Schumann. Gentlemen, the introduction of the group. You have, though I realize it, to review the document at this time to questions from the press committee's report.
Doctor, I'm appreciating that you will move promptly to determine the public health service. You consider how this committee constitutes public health service as regards smoking.
I think the answer to that is this is the report of others. Our adequate opportunity to study need to affirm that, on the other hand, personally and someone over it, I think excellent report.
Secretary, how do individuals report? How can they get them?
The representative documents is to involved agent similar persons with respect to furnish individual copies.
You send in a certain amount to get this report.
I think that, yes, inside the front, application number so-and-so, the superintendent of documents.
The average.
Yes.
Understand that there are 3 cigarettes, 1 cigar smoker among the committee. Their habits, this work, and if they haven't.
Frankly, I do not. Now, if you would like the time individually to the people that can't even name them. Just a moment, please. Let's complete.
Dr. Pfizer, and I think...
Dr. Seaver. That'll smoke
Dr.
cigar.
Schumann.
Dr. Caesar. Who was the other one?
I'm sorry, Dr. Schumann, Dr. Pfizer, and Dr. Cochran.
Dr. Schumann.
Dr. Terry, Jules Company.
Yeah.
How are the students who will receive COP likely in their minds to appropriate remedial action? You would, how self, sir?
In this respect, and this is one making an individual distribution, I think that each physical judgment on it. This report and any other available to him, report to be most effective and effective. Judgment not only throughout the country, but agencies.
When do you will get underway?
Be underway in the public health service. This.
Dr.
The report doesn't say anything about decision, committee, or is this a matter that...
I believe there is a discussion, or at least briefly, about. Could you answer that?
The report briefly, however, the committee felt enough evidence available today to make and their effect in time.
May I revert to the liquors in your midst? A cigarette smoker until a few.
That's correct. I smoke a pipe only.
Dr. Hamill, what are...
If I may ask it, I would like to individual is up later with our staff. I think Dr.
You're going to name...
I beg your pardon?
Almost exhausted the list now on Dr. Hamill.
Answer, please.
Pardon?
Reports that he smoked cigarettes. Dr. Hamill reports will continue to smoke cigarettes.
The field of remedial action.
Depends upon professional reaction. That one must realize that this is not federal government, just a concern of the medical concern of the. Therefore, I think one must answer to your question. Potentially, government all levels, paramedical profession. Certainly, as you know, of the voluntary health aid taken a considerable interest subject. Therefore, answer it by saying problem of national can depend in terms of what depend upon the reaction of any level in our structure. And we do not anticipate a simple. Now, what we health service at the present time is a steady going units and segments of whether or not we will committee will determine our action. I'm not certain at the moment.
On this, General Bernie's early, why specifically brought this study?
I think you may recall the Surgeon General Berney in the last official position taken by the Public Health Service prior to, or the last taken, was in 1959 when published the American Medical Association. At this time, a great deal of had accumulated over the past that needed and now for that reason to assemble this committee and to bring the information up to date.
Dr. Terry, you took a stand smoking principle etiologic in lung cancer and such an educational program throughout the country. Now, when we're discussing, we're thinking in terms of educational program, medical profession, or an educational program. In other words, question whoops this particular report.
Well, of course, well appreciate the public health does not in effect to patient risk except in a few beneficiaries that are taken. Therefore, it is a service in working full sense and through official health organizations. That I think I'm unable to say. Gertrude?
If you were in the privateness of this report about smoking,
would I advise my patient
on the basis of this report, patients about smoking?
Frankly, I would advise the conclusiveness of the clear indication of a hazard, that if one should certainly do mission that he was himself to a definite.
Dr. Science Service, Dean of the American Medical Association Research, Smoking and Health, is in the light.
Oh, I would say by all means, that this report will temper either our intramural public health service nor research which the public health system. We could expect that this would, for other good scientific research, notorious because they're on the subject.
Dr. Terry is being called for medical men the great new mid-20th century. If he could come up for a second. Find for us the committee's areas of public health problem.
Dr. Burke.
I think we have numbers. The mortality ratios of the 41,000 deaths. In this instance, the major causal is the so clear cut.
Is now established. This is what many men weren't satisfied with.
We have, for the remainder of the committee, into the lung, and cancer is mentioned here, bronchitis and emphysema, I believe. Causal relation. This conclusion is based on several different types.
Dr. Burdett might point out, as a comparison, 1,000 deaths from this country per year, the number of deaths last 8,000. Comparative substance. I would like to make clear, Dr. Answer to the question about my indicated that I continue to smoke. I would advise continue smoking cigarettes. But if smoking cigarettes, he should health hazard. I certainly would advise you.
Dr. Terry.
How much money is public health and research in the field is reviewing this report? How much?
I don't think we know. Projected estimation, the amount of money we spend in the field. We don't know how much. You are either, Doctor, how much we are supporting, and I would certainly there is well more than several $1 million going in one direction or another.
Terry, submit the report to the World Health, and also, do you believe can play a role in investigating this?
I think this report is submitted to the World Health unofficially, to them as well as to the ministers of countries throughout the world. What role WHO, but in general of WHO on an international fashion to how departments, public health departments can act in individual.
Dr. Terry,
yes.
The committee conclusions unanimously or on any major conclusion?
Lord, with the committee just the same. I have our unanimous conclusions of the committee.
Dr. Terry.
That's about when you expect action to be taken and if action by the government to discuss inflation.
It would be appropriate for me to misleading for me to tell you when it will be. I have every indication that within our department and welfare departments, this matter is of such significance and that I do not believe that in terms of explore are appropriate for individual.
Dr. Terry, the findings of this, in the light of your membership, member of the House of Delegates, I'd like to know if you'd action or more properly the House of Delegates in this subject of health hazards.
Well, I wouldn't like to comment on it. Frankly, the House of Delegates might have been to take any action or wait, since I believe most comprehensive report get available at the time in early December. What has been done, see what will be done.
Dr. Terry, if, I don't know, shuffling is any way of saying could, if there were no's today, what would it mean to launch for the American?
Dr. Hundley, I'd like to answer that question. Hundley, actually, as Vice Chair on the committee in its meeting, I think can.
The committee considered the possibilities, but it involved assumptions that they should not attempt this misleading as it was informative.
Dr. Terry, has President Johnson, what was his reaction?
President Johnson has seen the report, have been sent to the White House.
I'd like to clarify for me two statements. Cigarette is a between cigarettes. I'd like to get that.
I better answer this rather than for the committee. There is a brief in here of causal relationship for judgment. It was only a statistic that they would not conclude there was a causal relation. There may be a causal relation, sufficient evidence to establish. This would be true, for example, deaths from there's 7 smokers when compared to 9. The committee felt there was not to warrant that the relationship was, even though in this instance the numbers of deaths of course much larger. On the other, carcinoma of the lung, here to be a causal one, or I feel that this is carcinoma of the lung, and people do get smoke, and the ratio is 10, or that if smokers of 10 to 20 times smoke. Material found in carcinogenic when it's painted on in mice. In looking at tracheobronchial ebbing of the tracheobronchial, finds similar changes in the lung in comparison in animals. considerations as well. He says a causal relation, understanding that there is evidence in addition to conclusion here. It is the only, and in the case of cancer, is contributing to, but in the case of cigarette smoking, is the main.
Economic implications of this about the possibility of removing ingredients from cigarettes.
I don't think relative to weight, so that, and I would remind you again to the question of removal, rather to the question of smoking and health, hazard associated, and the magnitude of that.
Dr. Burney, Professor Dr.
I've even been.
In his report in November 28, 1959, method of treating tobacco has been demonstrated to be effective reducing or eliminating the hazard. Is this the view?
It is my understanding that insofar as having any proof treating, so.
Whether we asked about filters.
I'd like to ask Dr.
There's which will that filter in reducing the health.
Terry, excuse me.
Dr. Terry, as you know, which he's going to introduce on a major part of this, all cigarettes to carry use can, as a doctor, do you think this be on?
In the first place, I'm not of the stipulation that Senator Newberger. I'm a doctor official, and I have to say in that respect to study the proposal before a recommendation on. We are, on the other hand, the committee and Maine to answer any additional.
5 minutes to come back.
5 minutes break.